Welcome back. The name of this module is Assessment Tools for Use at National and Local Levels. By the end of the session, you will know which tools are available to assess, prioritize, and manage risks. Recall which tools are most useful for different situations, advocacy, national and local level assessment and implementation, and identify where selected tools and detailed methodologies can be accessed for Excreta Flow Diagrams, SFD, Sanitation Safety Planning, SSP, Sanitary Inspection Forms, SI. You will also be able to communicate where use of risk-based tools for data collection and system improvement has been catalytic. A case study from Ireland will give us a good example of how different risk-based tools have been deployed. There are many assessment tools for advocacy, national policy, and planning. These tools are available for assessing sanitation status and progress, the enabling environment, financial flows, stakeholders and markets, and targeting by disease. We will focus on SHIT flow diagrams, also known as Excreta Flow Diagrams, as a key high-level advocacy tool for identifying major risk areas at municipality level. This is an Excreta Flow Diagram, also known as an SFD. An easy-to-understand advocacy and decision support tool comprising a report which includes a visually friendly and understandable graphic. An SFD summarizes service outcomes in terms of the flow and fate of excreta in urban areas. It includes a qualitative assessment of the context in which service delivery takes place and provides a standardized assessment method. An SFD is not a precise scientific analytical tool or a direct representation of public health risk, but it will help you understand the major risks that need to be prioritized in your system. The 5 important steps to follow when making the SFD are 1. Location and context, 2. Data collection, 3. Stakeholder engagement, 4. A graphic generator, and 5. Reporting, reviewing, and publishing. Location and context aspects to consider include the boundary of the area for the excreta flow, the population, the different types of sanitation systems in the area, key physical and geographical feature, and the enabling environment for sanitation service delivery. For data collection, it is common to gather information on the types of containment, emptying and transportation, treatment, end-use or disposal systems within the geographic area. The data collection mapping also documents possible sources of information. Stakeholders are critical to the SFD development process, for without them, it is difficult to answer all the relevant questions. Engagement also serves as a means of gaining wider acceptance and support for the process. Experience has proven that the better the level of stakeholder engagement, the more likely the SFD report and accompanying SFD graphic will be accepted and used by decision-makers. Once you have collected the data for your city, you can use the graphic generator to produce your first SFD graphic. It is recommended to share and discuss your SFD graphic with other stakeholders. As delivery of urban sanitation services can be complex, producing an SFD for a city is commonly an iterative process requiring the sharing and discussion of several versions before reaching agreement with other stakeholders on a final version. Reporting, reviewing, publishing. Once agreement is reached, you can draft your SFD report using the reporting templates, have it reviewed by the SFD Promotion Initiative, and published on this web portal. There are a few implementation tools for sanitation system assessment, investment in improvements, and ongoing management. These operate at different levels, but generally address functions including coordination, identification of risk-based system improvements, and ongoing management, simple risk assessment and remediation, demand creation, behavior change, supply and financing, and policy strengthening. The most important and powerful tool in your toolbox is Sanitation Safety Planning. As recommended by the WHO Guidelines on Sanitation and Health, Sanitation Safety Planning is a step-by-step approach for local risk assessment and management along the entire sanitation chain. Sanitation Safety Planning helps you identify and prioritize the highest health risks, which in turn informs system improvements via a mix of control measures, including regulatory measures. Here you see the SSP manual available from WHO. We'll place a link to the manual and online learning platform at the end of this module. Because of its central importance, let's take a closer look at sanitation safety planning through this short video.
Hello, I'm Kate Medlicott, Technical Officer for Sanitation and Wastewater at the World Health Organization. In this video, I will give you an overview of sanitation safety planning and we'll look at an example. Sanitation Safety Planning, or SSP for short, is a risk-based management tool for sanitation systems. A safely managed sanitation system prevents exposure to disease-causing excreta at all steps of the sanitation chain, from containment through emptying, transport, treatment, and to disposal or reuse. It can be used together with Excreta Flow Diagrams, or SFDs, shown in the previous module, to make sure that excreta reaches safe rather than unsafe endpoints. SSP reduces health impacts while increasing the benefits of reuse. SSP can be used for all kinds of sanitation systems, both in formal and informal settings. The approach is best used for improving existing systems. In communities with no sanitation, demand creation should be prioritised. So how do SSPs work? First, we need to understand the system we plan to manage. This is referred to as a system assessment phase, where the sanitation chain and exposure groups and pathways are identified and expressed as hazards. Risks are assessed, and when they are unacceptable, improvements are designed to reduce them. This approach ensures action is prioritised according to risk. Monitoring and management using multiple barriers along the chain ensure that the whole system is operating as intended. SSP can be applied in many settings. Today I'll be illustrating the approach in an informal urban setting typical of growing cities in many countries. We'll follow the chain showing examples of exposure groups, hazards, controls and monitoring at each step to build up a safely managed sanitation system that protects public health. Notice as we go that not all improvements involve expensive capital investment. Changes in management and behaviour can also significantly reduce risks. Also notice that different stakeholders bear responsibility for controls and monitoring at each step. Here is a simple pit latrine with manual emptying. Although excreta are contained in the latrine, this unimproved system poses a number of health risks. Exposure groups include the users, the workers who empty the containers, and the surrounding community. Children and the elderly are especially vulnerable from contact with soiled surfaces in an unhygienic latrine. These groups may be exposed via direct excreta contact through the feet and hands, and when excreta is inadvertently transferred to the mouth via dirty hands or flies. The risks here are medium to high, depending on the exposure group. While the goal is a more hygienic, improved sanitation technology, we can still reduce risks. For example, controls such as wearing shoes, better cleaning of the latrine, personal protective equipment for workers, and using an emptying system that reduces direct contact will all incrementally improve the system. Visual monitoring of these measures by a community health worker is a simple way to check and respond if these controls are not in place. This latrine with septic tank is an improved technology that poses less risk to users than the previous situation. Let's look at the emptying process. Motorised emptying and transport is much safer than manual emptying, but there are still risks that need to be managed. A key exposure group is the workers. Hazardous events are mostly related to blockages and malfunction of the equipment. For example, the operators may be sprayed with sludge and also contaminate the surrounding area. These risks are typically high. Here are some controls to protect workers: providing appropriate equipment, working according to standard operating procedures, and ensuring workers wear personal protective equipment. The organisation responsible for overseeing collection and transport can set minimum standards like these and make spot checks to monitor if they are followed. In this example, all of the fecal sludge is delivered to the treatment plant, but in poorly managed systems, some may be diverted to dumping sites. This can have serious health and environmental impacts. SSP should also identify dumping as a hazardous event and include controls and monitoring to manage these risks posed to the wider community. At the treatment step, it is vital that the treatment process operates well so that effluent and biosolids meet agreed standards. If not, users on farms and consumers of the farm produce will be exposed to an unacceptable risk. The hazardous events may include overloading of the plant, breakdowns, the processing temperature and time, and the presence of flies or mosquitoes, or seasonal factors such as high rainfall that may affect performance. The risks and consequences of these are high. Example controls include proper design and construction, trained operators, and a preventive maintenance program. Monitoring may include periodic testing of effluent and checks on delivery volumes. But even the best treatment processes will occasionally not meet standards. In some cases, lower levels of treatment may be unavoidable with the existing technology or desired by farmers who wish to access nutrients for reuse. That's why barriers at the next reuse step are particularly important. During reuse, there are risks to farmers using the biosolids, especially where intestinal worm infections are prevalent. Risks will depend on the performance of the treatment plant in the previous step and the way the biosolids are applied in the farm, for example, manual or mechanical application. When produce is sold to the general population for consumption, many people are potentially at risk. Pathogens can be recycled back to the community at large and lead to a disease outbreak. This is costly in terms of public health, but it can also ruin the reputation and operation of businesses that reuse wastewater and sludge. The type of crop grown and the application method affects the risk for consumers. For example, crops eaten raw have a much higher risk compared with crops which are cooked or processed before eating. These risks are potentially high. Controls that can be used include selection of crops not eaten raw, setting a time between the last application and harvesting to allow pathogens to die off naturally, and washing of produce in clean water before sale. Monitoring may include checking crop types, application and harvesting practice, as well as hygiene during the packing and sale. We have just followed the modules in the SSP manual. First, describing the sanitation system, identifying hazardous events and exposure risks, developing and implementing improvement plans, monitoring controls and verifying performance. Coordination amongst stakeholders is needed to implement all controls and monitoring in a safely managed system. That's why establishing a team at the outset with members representing each step of the chain is vital to prepare for SSP. Coordination can be challenging, but evidence shows that safely managed systems lead to far higher health gains than improved sanitation alone. Further, using the multi-barrier approach reduces dependence on capital-intensive treatment technologies as the main barrier. Controls can be included at any step and incrementally improved over time as resources permit. In summary, SSP is a risk-based tool for safely managing existing sanitation systems. SSP coordinates improvements and monitoring by actors along the sanitation chain. SSP does not rely on treatment only. It uses multiple barriers, including behaviours, management and technology to prevent exposure. The SSP manual that includes more guidance and tips is available in several languages on the WHO website, along with other resources to help users get started and implement SSP.
We hope you found that short video informative. An online training platform has been prepared to support you in your work with sanitation safety planning and to help equip local SSP stakeholders with the needed knowledge and skills to initiate, participate, and sustain SSP locally. The online training course has been designed to cater the needs of the different stakeholders. It includes a ladder training approach which allows participants to choose the depth of learning they prefer depending on their roles in SSP and their available time. Let's look at some of the benefits of sanitation safety planning. 1. It allows coordination of the many different actors involved in sanitation service delivery and oversight. 2. It helps you prioritize investment and monitoring according to risks and clarified lines of accountability for delivery. 3. It combines technical, behavioral, management, and regulatory controls measures to achieve a safe system. 4. It helps identify specific climate risks and reliance investments. And finally, collectively, SSP frames the ongoing management system. Of course, there are limitations to any approach. For sanitation safety planning, these can be 1. SSP can be challenging to understand at first. 2. It requires buy-in a high level in the municipality or district where SSP is being implemented. 3. And it requires ongoing training and follow-up. A simpler form of risk assessment and management is sanitary inspections. WHO developed a sanitary inspection form in PDF and tablet-ready form that can be used for all of the most common kinds of sanitation facilities. It is a short, standardized observation checklist that can be adapted and used to assess risks and identify appropriate remedial actions to meet SMS definitions as described in Module 2, and thus safeguard public health. Sanitation inspections look at the parts of the sanitation chain that can be observed at the household level. Therefore, they only cover the toilet and containment and on-site treatment steps of the chain. Other tools are needed to assess conveyance and treatment and disposal or reuse off-site. Sanitary inspections are ideally carried out periodically by local government officers to check on sanitation status. Inspectors can advise households of any remediation needed and refer them to competent service providers where needed. A representative sample of forms can also be aggregated to local or national level to determine the proportion of systems that are meeting safely managed sanitation criteria. Examples of applications include quality assurance and compliance with technical standards and regulations, district system strengthen to monitor and prevent backsliding after reaching ODF status, routine surveillance to inform regional and national priorities, or program monitoring and evaluation. Let's now look at the parts of the sanitary inspection package. The first is the Sanitation System Fact Sheets for 11 common systems found in the annex of the Guidelines on Sanitation and Health. These contain basic technical information to support the completion of the sanitary inspection form. They provide more information on applicability, design considerations, operation and maintenance, and measures to protect public health. The sanitary inspection forms provide a checklist of observational questions to support the identification of risk factors that may need corrective action. Finally, users can refer back to the system fact sheets for management advice to identify remedial measures for risks identified in the inspection. Here are some of the benefits using these documents as part of the sanitary inspections. First, they are user-friendly and can be used by non-specialists. Second, They offer easy and quick hazard identification. Third, they are suitable for use in situations of limited time and resources. Fourth, they can be easily adapted to different contexts. And fifth, importantly, they can be aggregated to report on SMS in situ for SDG 6.2. Limitations include limited number of questions, which therefore does not capture all possible risk factors. This is in part because risk below ground and inside containment are not easily observed. The forms assume every risk has an equal value, and they may require adaptation to local context. You can find all these forms in PDF and online formats on the MWater platform. So let's see how we can bring it all together for SMS in the context of the SDG 6 acceleration framework and achieve SDG 6.2. You may recall that the acceleration framework has 5 components: data and information, governance, financing, capacity development, and innovation. In the example that follows, we will see how work on combining acceleration on governance and data and information has been a game changer for on-site sanitation in Ireland. Even though Ireland is a high-income country, this example holds lessons for all countries in the way it has efficiently strengthened monitoring and regulation of on-site systems. Let's look at how the various practices for safely managed sanitation come together by looking at regulation of domestic wastewater treatment systems in Ireland, a presentation made to the WHO-managed International Network of Drinking Water and Sanitation Regulators.
Here we will learn about the regulation of domestic wastewater treatment systems in Ireland and see background information on the regulatory system. There are 4 main areas. The first relates to planning control regulations and standards that are required for the construction and installation of domestic wastewater treatment systems in Ireland. The second relates to the registration and inspection of these systems under the National Inspection Plan. Inspections are completed nationally but prioritised in highest risk areas. The third area relates to the grant schemes that are available to fix systems that fail inspection. And lastly, the local authorities may deal with some complaints regarding septic tanks, and they may carry out inspections following the receipt of a complaint. This is a list of the main legislation relating to septic tanks. The Water Services Amendment Act was brought into law in 2012. The Domestic Wastewater Treatment System Regulations, which govern the operation and maintenance of domestic wastewater treatment systems, and the requirements for desludging, were also brought into law in 2012. At the bottom of the list are the Housing Financial Assistance Regulations that brought the septic tank grant schemes into law to help householders fix systems that fail inspections and in other areas. Inspection responsibilities are provided for under the Water Service Amendment Act that was brought into law in 2012. Homeowners had to register existing systems by the 1st of February 2013. The homeowner is required to comply with regulations, and they must ensure that the system is not a risk to human health or the environment. The homeowners can't refuse, obstruct, impede, mislead, or fail to comply with an inspection. The water services authorities are the local councils, and they must take and maintain registrations, and this is done through the protectourwater.ie website. The Water Services Authority inspectors conduct the inspections of the domestic wastewater treatment systems, and they enforce the findings and issue advisory notices on the inspections. The EPA's responsibility is to appoint inspectors, issue the National Inspection Plan, and supervise the Water Services Authority's work in this area. Some of the key requirements of regulations are shown in red on this slide. Domestic wastewater treatment systems should not leak. Roof water or surface water should not be allowed to enter the system. All parts of the system should be fit for purpose. Systems should be dislodged at appropriate intervals by an authorised contractor. The EPA provides a simple reference table on its website to help homeowners establish what an appropriate interval would be for their system. Homeowners need to keep receipts of desludging. Overall, Homeowners should ensure that their system is not a risk to human health or the environment. The National Inspection Plan began in 2013. The next plan covered the period 2015 to 2017, then 2018 to 2021, and the latest plan covers 2022 to 2026. Under the most recent plan, water services authorities are required to complete a minimum of 1,000 inspections nationally per annum. This increases to 1,200 from 2023. They may complete additional inspections where evidence exists that domestic wastewater treatment systems are causing an issue in a particular catchment. The 1,000 or 1,200 inspections are prioritised into areas of highest relative risk. These are close to rivers and areas with shallow soils and drinking water wells. The number of inspections are allocated to water services authorities pro rata based on the proportion of houses in those risk areas in the water services authority area. Specific site selection is done annually by the water services authorities using a map and tables which show the various risk zones and the number of inspections to be completed in each risk zone as set out in the National Inspection Plan. Inspectors in the water services authorities attend a training course. There are approximately 100 inspectors nationally. Inspectors would expect the following from a good system: no rainwater or clean surface water entering the system, no leaks, no ponding, no unauthorised discharges, components in working order, proper maintenance and operation being completed, the system is dislodged, and the system is not a risk to human health and the environment. If a system fails and remediation is required, the Water Services Authority issues an advisory notice to the homeowner, which outlines the measures required to fix the system and the timelines for completion of remediation works. If any structural remediation works need to be completed, there are planning exemptions under the Planning and Development Regulations to allow homeowners to improve a system without requiring planning. Also, variances to the Code of Practice requirements may be considered by the local authority. There are grants available to help homeowners fix systems that fail in an inspection, so this allows them to fix their systems more readily. So, just to give you a flavour of the latest report, the Domestic Wastewater Treatment System Inspections Report was published in June 2022 and reported on the inspections completed in 2021. There were 1,147 inspections completed in 2021, and these found that 53% of systems that were inspected failed inspection. Overall, in the period from when the National Inspection Plan began in 2013 to the end of 2021, 75% of systems that failed have been fixed. So that leaves a quarter of them that still need to be fixed. In some of these, legal cases have been initiated. In total, 36 legal actions have been initiated by 7 water services authorities nationally. The figure shows the reasons for failure. It should be noted here that individual systems can fail for multiple reasons. You will see that the leading issue found is that homeowners do not dislodge and maintain their tanks. The pictures were taken by inspectors in the field, and they show a discharge to a surface water drain and effluent ponding around a septic tank. The final slide outlines some of the engagement work that is carried out in this area. This is done to provide information to the public about inspections, the risk of their systems not working properly, and how they can fix their systems. Several information leaflets have been published to help with public engagement, which are used by water services authorities to inform the public in their area. The EPA also publishes a simple infographic to inform the public of the findings of the latest inspections report. It gives a very high-level flavour of what the inspections are finding and where homeowners can find assistance to enable them to fix their systems.
In this example we have just seen from Ireland, you would have noticed multiple benefits to sanitary inspection as part of a process for safely managed sanitation. These benefits include a risk-based approach to sanitation, small but nationally representative samples, links to follow-up improvement by households and municipalities, deployment of information, incentives, enforcement and strengthening of national and local level governance, and mechanisms for accountability to national and regional regulators. Congratulations for reaching the end of Module 4 and this course. With this module, you will have learned how to identify highest risks in sanitation systems using excreta flow diagrams, in high-risk locations using disease prevalence maps, use of simple sanitary inspection forms to assess and identify improvements, and how to use sanitation safety planning to support area-wide improvements in districts and urban areas. To continue your learning or practice of safely managed sanitation, visit the Sanitation Safety Planning Manual and Training Platform where you will find the sanitary inspection forms, and visit the SFD portal where you can create your own visualizations. The links are included below. Thank you.